Assalamualaikum warahmatullahi wabarakatuh. Before I begin my presentation, let me introduce myself first. My name is Stephanie Ramadhani Fadilah, with adalah student number 258, and I'm from class H. So let's get started. The title is Pharmacy Culture Around the World, a look at Austria. Pharmacy is a global profession shaped by history, regulations, and public expectation. This presentation focuses on Australia, which is a country where pharmacists are deeply trust education in rigorous and largely state founded, and the profession is evolving from traditional dispensing to expanded clinical roles. So we'll compare all of them. One is Australia pharmacists, a trusted pillar of society. Pharmacists in Austria consistently rank near the top of public trust surveys, often second only to firefighters in Reader's Digest inquiries. This trust is rooted in reliable, frequent patient contact, clear advice on medication use, and visible professionalism in community settings. So high public confidence enable pharmacists to play a stronger role in preventive care and medication management. Next. Austrian pharmacy culture combines long-standing public trust with a structural strength. Free higher education for pharmacists, strict quality controls, and community accessibility rules. At the same time, Austria is adapting to global pressures, is bending clinical service and research into practice. And the result is a balanced model that preference core professional values while encouraging modernization and patient-centered innovation. Next. Okay, in Austrian medicines, marketing is shaped by a strong regulation culture and a cautious public approach to pharmaceutical promotions. Perception medicines cannot be directly advertised to consumers under Austrian and EU rules, while over-the-counter products may be promoted more openly with approved claims and record safety information. Compared with the United States, Austria does not permit broad direct-to-consumer advertising to prescription drugs. Pharmaceutical companies instead focus on healthcare professionals through medical education, congress sponsorship, journal advertising, digital detailing, and compliant field marketing. Public attitudes in Australia tend to favor conservative, evidence-based communication over aggressive commercial promotions. As a result, medicine advertising is expected to support informed choices without exaggeration or misleading claims. Oversight come from Austrian authorities and EU frameworks, with the EMA influencing standards for product information and advertising claims. And together, these rules create a market where promotion exists but within clear ethical and legal boundaries. The packaging and dosage from preference are vary across regions, but Austrian pharmacy places strong emphasis on practical, safe, and patient-friendly choices. Common dosage from include tablets, capsules, liquids, inhalers, and topical medicines, each paired with packaging that supports correct use and secure storage. Blister packs, bottles, unit dose formats, and clearly labeled cartons help improve medication safety and adherence, while pharmacists also consider sustainably child-resistant filters and ease of opening for all older adults. Next. Uh, in Australian community pharmacies, pharmacists do far more than dispense medicines. They prepare and distribute prescription medications accurately, apply safety checks, and ensure each product is labeled correctly before it reaches the patient. They also provide patient counseling on how to use medicines properly, explain possible side effects and drug interactions, and support adherence so treatments work as intended. Community pharmacies also help people choose appropriate over-the-counter medicines for common ailments and carry out medication reviews to assess whether a patient's treatment plan is safe and effective. Many pharmacies now offer health screening and monitoring services such as blood pressure checks and blood glucose testing, along with a support for chronic disease management in conditions like diabetes, hypertension, and asthma. In addition, some pharmacies provide vaccination service where permitted and are expanding clinical roles through minor ailments schemes, smoking cessation support, and medication therapy management. Uh, Global contrast pharmacy in Australia in versus in Indonesia. While Australia is relies a highly integrated and trusted pharmacy system. Other nations like Indonesia presents a different landscape shaped by a diverse cultural, economic, and healthcare priorities. This comparison highlights how two fundamental aspects of pharmacy and can vary significantly across the globe. Um, in Australia, is a high public trust, clinical advance, rigorous education, and rare traditional medicine. Also in Indonesia, it's like a trust through personal ties, community presence, localized training, and integrated traditional medicine. Um, this is a lesson or conclusions about the slide before. One of the most striking cultural facts about Australian pharmacy is the exceptionally high public trust pharmacists enjoy, often ranked second only for firefighters. That trust is not accidental. It comes from rigorous education, strict regulation, and consistently high professional standards that make pharmacists seen as reliable health experts, just not just medicine dispensers. This matters because trust gives pharmacists room to grow. In Australia, it helped the profession move beyond dispensing into clinical roles, medication review, preventive care, and closer collaboration with other health professionals. When the public trusts pharmacists, the health system can use their expertise more fully. Indonesia can learn from this model in practical ways. It's like in first in rigorous and accessible pharmacy education, strengthen quality control and safety standard, build trust through transport evidence-based practice, and create clear regulatory frameworks with a strong professional standards. Over time, pharmacies can gradually expand from dispensing toward more clinical services. Indonesia can also integrate traditional medicine knowledge with a modern pharmaceutical practice, but in regulated way that protects safety and credibility. So this is my presentation. Thank you for attention and learning, and see ya. Assalamualaikum warahmatullahi wabarakatuh.